Good afternoon. Uh, I would, before starting my presentation, I would like to thank Dr. Pratap Gupta, founder, International Patient Union, and former advisor to Union Health Minister, for inviting me on this important topic. And when one has a stomach upset or body pain or vomiting, where does one go first? Obviously, the nearby pharmacy or chemist shop. Globally, this setup is called community pharmacy. Community pharmacies are the first point of contact to the people before going home. Thus, community pharmacies hold a unique place in the healthcare system. Community pharmacies are rightly called as first port of call health professionals and are the face of the pharmacy profession for the public. During COVID pandemic, pharmacists and pharmacy staff have been at the forefront and have demonstrated the true value of pharmacy profession and made us proud than ever before. Globally, pharmacists' role has expanded way beyond the core job of dispensing. Pharmacists offer a variety of services based on people-centered care, medication counseling, health screening activities, medicine use reviews, prescription audits, monitoring adverse drug reactions, de-addiction services, harm reduction services, health promotion, home medication reviews, emergency prescribing are some of the examples of the pharmacy services available globally. Pharmacists administer vaccines, including COVID vaccines, and pharmacy-based immunization services are well established. Good pharmacy practices are followed by pharmacies. Competencies of pharmacists, national pharmacy standards, and pharmacy-related policies are well defined. Pharmacists get the relevant knowledge, skills, and confidence through pharmacy education and training. Also, continuing professional development is mandatory in most countries. Pharmacists, they get paid well for their services. Overall remuneration and working conditions or setup are quite conducive. In public opinion polls, pharmacists have been rated by society as the most trusted professionals. But in India, when the country is celebrating its 76 years of independence, and even though India is a top leader when it comes to pharmacy industry and when it comes to pharmacy industry, as India has been dubbed, quote unquote, the pharmacy of the world. Pharmacy practice has not evolved with time. More or less, with very few exceptions, pharmacies are the drug selling shops and not yet healthcare settings. We don't have the true community pharmacy concept developed yet. We can't recognize who is a pharmacist in our pharmacy shops. Sometimes we don't find pharmacists in many shops, especially in some parts of India. Then, where the question of professional patient care service arises. There are exceptions, and some pharmacists have been new generation pharmacists who are excellent patient counselors and have won the respect and trust of patients and physicians. But the number of such pharmacists in the country is very low. In general, the problems faced by the community pharmacists are many, some of which are inadequate incentives. Anyone can open a pharmacy. It is not the exclusive domain of the pharmacist. At present in India, there is no practice of charging professional fees for dispensing prescriptions. Too many Me Too brands in the market. India has many drugs and fixed dose combinations in the market, and more than 1 lakh brands, making inventory management a tough job. And finally, work-life balance for pharmacists is very poor, as they keep pharmacy open for minimum 12 to 14 hours to get enough business. We are a huge country with more than 7 lakh pharmacies. As per WHO, it is clear that pharmacy has an important role to play in the healthcare sector reform process. To do so, however, the role of pharmacists need to be redefined and reoriented. This is where we need to act upon immediately. All stakeholders need to be at one table to develop a white paper or vision to strengthen the community pharmacy practice in the country. Policymakers have not yet realized the potential of pharmacies and have not yet developed trust as well as interest to develop the role of pharmacists. For improving population health, in the last 2 decades, the Indian Pharmaceutical Association, with the support of International Pharmaceutical Federation, has made several representations and meetings with policymakers. One of the success stories is recognition of pharmacists' role in revised TB control program by Government of India way back in 2012. After presenting actual evidence of pharmacists' work in the field and positive experience sharing by stakeholders such as local and state TB control officers, WHO TB consultants, pharmacists and patients. This policy change was the result of consistent work and advocacy from 2005 by IPM. But such success stories are very few. One case in point has been the IPS TP project since beginning and worked for years at the ground level. So after the entry of pharmacists in the TB control program, efforts were made by IPA to get pharmacists' role developed in the diabetes control program, but the road has not been easy. So in the end, because of the time, being a huge country, it is difficult to make your voice heard. Strong advocacy with consistency and evidence of actual work on the ground are necessary. Politicians and bureaucrats need to be convinced, but usually pharmacy-related issues take a back seat. Many activists emerged in last few years for uplifting pharmacist status in the country, but till date it appears that all the efforts have been sporadic. There is so much to do in the country in the healthcare sector. The aging population, growing burden of non-communicable diseases, increasing irresponsible use of medicines, drug addiction, polypharmacy, endemic and epidemic infections are few of the issues. Pharmacists can contribute a lot to safeguard the health of the citizens and can fulfill the shortage of human resources in the healthcare sector. I am of the opinion that community pharmacy is part of the solution to many problems of public health. Community pharmacy is waiting for a brighter future, and we all healthcare professionals who are gathered here must work unitedly, shoulder to shoulder. Thank you all for patient hearing, and thanks to the organizers, International Patients Union, for inviting a pharmacist to this very important stakeholders conference. Thank you so much.